The pregnant women have to travel to different cities, different hospitals during their labor to find the bed to deliver the baby. There are days when I absolutely love the Sweden's healthcare system. There are days when I absolutely hate the system. Hi guys, how are you doing? I'm doing super good. I'm doing amazing like always. And I welcome back once again on my channel. Sweden's healthcare system, Sweden's medical care is a topic of discussion at various forums. In this video, I would like to cover everything about Sweden's healthcare system, Sweden's medical care, how exactly the Sweden's healthcare system works, what are the general approaches of doctor, how exactly you can reach out to the doctors, nurses or to the midwives. And also I would like to talk about the cost, how much exactly it can cost you if in case you would need any kind of medical care, any kind of health care. And also I would like to touch upon the point that what are the common difficulties that many of the Swedish residents are facing with this Swedish healthcare system. What are the common difficulties, what are the flaws related to the Swedish healthcare system. I'm quite sure if you watch this video until the end, you will get to know everything about Sweden's healthcare system, about the Sweden's medical care that you should know, you must know if you are living in Sweden or if you are planning to move to Sweden. For that, please stay tuned until the end. And also do not forget to like, share and subscribe to this channel. Please watch other videos on this channel. I have covered many topics related to Sweden, talking about how does the Sweden's healthcare system works. Sweden's healthcare system is centralized, it is universal and also automatic. What do I mean by universal is that all the Swedish residents, all the people living in Sweden will get some minimum medical care while living in Sweden. And also it is automatic, which means as soon as you receive your personal number, you will be directly registered under Sweden's healthcare. You will get the social insurance through your personal number, which means you do not have to pay a lot of money for your medical care since you will be covered through your social insurance. Sweden has both public and private healthcare. But from the consumer point of view, from the patient's point of view, from my point of view, it will not make any difference to me because I will pay the same amount that I might pay at the public healthcare to the private healthcare. If I am taking, let's say, ultrasound, so I will pay the same amount that I might pay at the public healthcare to a private healthcare. There is no difference in terms of any of the regulation, cost and also the medical care or also the quality of the care that you might get. It is regulated through the same regulations, through the same laws. So from your point of view, you do not have to think that you're going to a public healthcare or private healthcare. It will be same from cost point of view, from the quality point of view. How do I reach out? How do I contact to a doctor or to nurse? There are 3 different ways that you can reach out to a doctor or to a healthcare center. The first and foremost thing that you have to do once you get your personal number is please register yourself to your nearest ward center or to healthcare center. So when you fall sick or when you fall ill, you can reach out to your nearest ward center, to your nearest healthcare center. The second option is call to 1177. They will guide you what exactly you have to do. For example, let's say I have a fever, then I can call 1177. They will see, okay, how serious I am or how serious my illness is. Do I need to visit a doctor or no, it can be cured with just waiting for 2 days. My body will recover on itself, or do I seriously need to go to a doctor? And they will guide me. Probably they will book an appointment on my behalf. And third option is call through emergency number, which is 112. If in case you have an emergency and you would need immediate health care, if you need immediate medical care, in that case, please call 112 and through them, they will check how serious are you, and if you are not able to walk or if you are not in the condition to move also, they probably might send ambulance, and through that ambulance you can reach to the hospital. Interesting thing about this emergency care is that once I had an infection and then I contacted 112, they booked an appointment for me on the same day and I went to an hospital. So in the hospital there were so many patients. If you are living in Sweden or if you know little bit about Sweden's healthcare system, then you know Sweden's healthcare system is so crowded. Everywhere you have to wait in the queue. So in the emergency care also had to wait for 4 hours. So in the emergency care, they will see to the individual patient that how serious are you. For example, let's say somebody had an accident and he or she would need immediate attention. So they will prioritize that patient over me. They will not give priority to me because I can wait at the hospital. My emergency is not super priority to them since the other person is losing a lot of blood probably, or would need immediate medical care. So do not expect that the moment you go to the emergency hospital and you will get immediate attention. No, based on your situation they will prioritize the patient. Okay, maybe you have 12 patients at the hospital and probably your number will be 4th or 5th. So if you're going to hospital, please go with lot of patients. I'm sure you will get enough attention when your number will come, but still you might have to wait, because I had to wait in the hospital for 4 hours. And the funniest thing is, I was waiting in the hospital for 4 hours and my husband was waiting outside the hospital for 4 hours because he could not accompany me inside the hospital. So we both were waiting. He was waiting outside and I was waiting inside the hospital. But the moment I visited the doctor, she was quite cordial, she was quite nice and kind, and I had like all kind of tests. I do not have to wait for my test on the next day and they will tell me, okay, what's happening, how serious the infection was. No, that was not the case. I got the results immediately on the same day. I was being given enough care, I was being given enough treatment, and also the prescription on the same day. So I did not have to follow up again for the same kind of infection, but on the same day I had to wait in the hospital for so many hours, which was little bit annoying. This is just a heads up. Do not expect that if you are going through the emergency care also you will get an immediate attention. Based on your situation, it can happen, it cannot happen also. So please have patience and keep this thing in mind. Interesting thing about Sweden's healthcare system is that you will not directly assign to a specialist. You will be first assigned to a generalist. He or she will check your illness, will assess how serious are you, and then based on their knowledge they will decide, okay, maybe you can be treated with only generalist, you don't need to go to a specialist. And if they think no, they cannot treat you, then you will be assigned to a specialist. For example, in my husband's case, he had a shoulder pain. So he booked an appointment through 1177. He got appointment after 2 weeks. It was appointment with a generalist. So he checked, is it a muscle pain or bone pain, or did he had any kind of serious internal injury or something like that. And he decided no, he cannot check in detail. So he had to assign my husband to a specialist. So he got another appointment after 2 weeks to a physiotherapist, and then my husband visited to a physiotherapist. So you do not get a direct appointment to a specialist. In my husband's case, he had a shoulder pain. If I would have been in any other country, probably we would have approached directly to a physiotherapist, but that's not the case in Sweden. You have to go through a generalist. He or she will check what kind of illness it is, do you seriously need a specialist or not, and then they will assign your case to a specialist, and then you have to visit them. So basically you have to keep a lot of patience if you are living in Sweden, which is in general, in case of every system, anything, bureaucracy is so strong in Sweden that you have to keep a lot of patience. Even in case of you have to get a personal number, you want to call to a customer care, you want to take a healthcare facilities, or you want to have a doctor's attention. In any case, you have to have a lot of patience. I think since I have moved to Sweden, I have got used to of waiting in the queue. Talking about the cost, how much it can cost you if you are seeking some kind of medical care or healthcare in Sweden. Sweden's healthcare system is not free of cost. You pay a lot of taxes to get this social insurance. You pay a lot of taxes to get this healthcare insurance that you have through your personal number. 85% of the Sweden's healthcare is funded through your taxed amount. So please do not think that, okay, if Sweden is providing and the government is providing some kind of social insurance, it is at free of cost. No, you are paying a lot of taxes to get these benefits in Sweden. If you are visiting to a healthcare facility, or if you are visiting to a watch center, so probably for your every visit you have to pay 250. For example, in my husband's case, when he visited to a generalist for his shoulder pain, he had to visit for his first appointment as 250 crowns, and also for his second appointment he went to a specialist. He had to pay 250 crowns. But let's say you have to visit to a hospital frequently, maybe twice a month or maybe every week. In that case, maximum in a year what you pay is 1300. Beyond that, whatever amount you are paying will not cost you, it will be free of cost. Beyond that, whatever visits you are doing will be free of cost. You will get a free card. There is a maximum cap which is called as high cost protection. Let's say I have spent 1300 crowns for my appointment in 6 months. In that case, I do not have to spend anything else apart from 1300. So maximum what you should pay to a hospital for your visits is 1300 crowns. That is the high cost protection cap. Beyond that, whatever medical treatment you will get will be at free of cost. You will not pay anything for that. For example, let's say I already had 4 visits to a hospital and I already paid maybe 1000 crowns. I will pay another 300 crowns for a hospital visit, and beyond that, whatever visits I do, it will be at free of cost. I do not have to pay for at least entire year. The interesting thing is you do not have to keep track of okay, how much amount have you paid to the Swedish healthcare for this medical care and all that. As I said, Sweden's healthcare is centralized, so all your records, all your data is being stored through your personal number. So you do not have to keep track of how much money are you spending at the healthcare. The healthcare, they themselves will assess your case. If you have already spent 1300 crowns to a healthcare, in that case you will not be asked to pay anything more than that. You have to pay maximum to 1300 crowns. Apart from visiting to doctors, nurses, apart from the healthcare or medical care that you get, you also might have to take some prescribed medicines. So for that, the cap is different. This 1300 cap is only for the healthcare, medical care that you get at the birth center hospitals. It's not for your prescribed medicines. For prescribed medicine, the cap is 2600 for a year, which is different from this 1300 crowns. So do not get confused. For the medical also, for the pharmacy also, for your prescribed medication also, you have a certain cap. You have a maximum limit beyond which you do not have to pay, which is again called as high cost protection for your prescribed medicines. One interesting thing about the pharmacy or the prescribed medicine is that you will not get any prescription in the hand. Doctor will write that prescription in your journal, and which will be linked to your personal number. So the moment you reach to a pharmacy, you just have to tell them your personal number. They will have access to your journal and they will give all the medicines which was prescribed by your doctor or by your specialist or nurses, and they will give you all the medicines. So you do not have to keep track of all the receipts that hospital probably would give you, or you do not have to keep track of any of the prescribed medicines that doctors are giving. That will be automatically recorded in your journal, and the pharmacy will have access to that journal, and through them you will get the prescribed. Interesting thing about Sweden is that Sweden's hospitals, Sweden's healthcare do not believe in antibiotics. You will get very minimal prescription for the antibiotics. Even in the pharmacy, if you do not have prescription to a certain antibiotics, you will not get those antibiotics at the pharmacy. You cannot reach out to pharmacy and ask for some kind of medicine without prescription. Of course, you can go to pharmacy and purchase vitamins and other kind of medicines that would not need prescription, but especially in case of antibiotics, you would need prescription from the doctors, and doctor do not recommend antibiotics in many of the cases. Doctors here or medical system here in general believe in autoimmune, which is hard sometimes because it takes a lot from you during your illness to recover. But yeah, doctors are quite rigid. Healthcare system is quite rigid here. Sometimes it's good and sometimes it's quite annoying, but yeah, that's how it is. Children from the age of 0 to 17 do not have to pay for any kind of medical attention that they would get. They do not have to pay for maybe the doctor's visit, for the healthcare facility, or for at the nursing home. They do not have to pay. And also you do not have to pay at the midwives clinic. For example, in my case, I am pregnant. Till now, I have had 7 to 8 visits to a midwives, but I have not paid even a single amount to the midwife. I am just paying for my vitamins that I have to take at the pharmacy. But apart from that, all the medical care, all the attention that I am getting during this pregnancy is at free of cost. I had 2 ultrasound till now, which was recommended by my midwife, and the ultrasound was also at free of cost. In initial phase, I had booked an extra ultrasound. For that ultrasound, I had to pay because it was not recommended from my midwife. Apart from that, I have not paid anything for all the attention or all the care that I am getting during this pregnancy. So I think that ways, cost wise, Sweden's healthcare system is quite affordable to all the people residing in Sweden. Dental care is not covered under your healthcare system, under your social insurance. For the children from the age of 0 to 23, The dental care is at free of cost. You do not have to pay anything, but beyond that you probably have to pay more than what you pay for your primary care, maybe for other kind of illness. The dental care is not covered under your social insurance, which is again is discussed a lot, especially amongst the elderly population, because dental care is one of the essential area of care that many elderly population would need. People living in Sweden are struggling with the dental care because it might cost a lot of amount for the dental care. But yes, the fact is dental care is not covered under your social insurance unless you are a child, unless you are between the age of 0 to 23. So many people prefer to have a separate insurance for your dental care apart from the regular social insurance that you have, who are covered under the Sweden's healthcare system. All the Swedish residents living in Sweden are covered for some minimum health care, for some minimum medical care. But if you have personal number, you are definitely covered under the Sweden's healthcare system. You will get all kind of primary care, emergency care, and also the child care that you would need. Children from the age of 0 to 17 will get all the benefits, even if you are a refugee, even if you are an asylum seeker kid, even if you are not documented in Sweden. In that case also, as long as you are living in Sweden, kids from the age of 0 to 17 will get all kind of medical care, as good as a Swedish citizen is getting. But what happens, let's say I fall sick but I don't have a personal number, but I have already applied for it. In that case, what you can do is, please go ahead, take all the medical care that you would need, keep the record, keep the bills of the medical care that you have received, keep the bills of all the medical attention that you have received. Once you receive a personal number, you can reclaim for the reimbursements of all the expenses that you have done. So the medical care, they will assess, okay, how much have you spent. If you have spent a lot of amount beyond the high cost protection amount, so whatever the leftover amount is, you probably will get the reimbursements. So please do not worry if you do not have a personal number, but if you still have registered, you can still seek for the medical attention and you will probably get the benefit. Maybe not immediately, but after receiving a personal number, you would get the benefit. So the first and foremost thing that you should do once you land in Sweden is apply for a personal number. I would say it is very, very essential to survive in Sweden to have a personal number. It is linked to everything, your healthcare, to your Sketavake, to your migration, every other details is attached to your personal number. So the first thing that you must do once you land in Sweden is apply for a personal number. I hope by now you have understood how to contact to a doctor or how exactly Sweden's healthcare system works. But what are the difficulties that many Swedish residents are facing with the Swedish healthcare system? In general, if you see the ratings of Sweden's healthcare system, if you see the global ratings, Sweden's healthcare system have been rated very, very highly. The mortality rate, the maternal mortality rate or age of average living population is quite high compared to any other countries. But the major flaw in the system is that the system is heavily crowded. There are very limited generalists. There are very limited doctors and nurses. The staff is very limited. The hospital cares and facilities are very limited, and the population is increasing day by day. There is a lot of burden on the Sweden's healthcare system, and probably they are not able to serve to all the population that they have. So you have to wait in lot of queues. As I said, even in the emergency situation, you probably have to wait. For the simple appointments, you have to wait for weeks. I know a friend, her father had to do a surgery and he is quite old, like he is probably 78 years old, and for that surgery her father have to wait for 3 months. Now they are looking for any other city, if they can approach to some different city to get that surgery done so that they don't have to wait for 3 months. There is a heavy burden on Sweden's healthcare system. You might have heard about the cases that pregnant ladies are not getting bed during the labor. Sometimes the pregnant women have to travel to different cities, different hospitals during their labor to find the bed to deliver the baby. Although the maternal mortality rate is very, very low, and it's the maternity care or the maternal care that you get within Sweden is quite high, but the bed or the maternity wards are quite limited, and which is again a crisis, which is a big crisis in Sweden. And I'm also a little bit worried for that, because it has been discussed at every conversation that I have with many of the mothers, when I discuss about the labor or about the deliveries, what kind of hospital I should choose, which hospital probably will have less of crowd, and which hospital probably would have more crowd. So I am quite skeptical about that, because I have heard so many horrifying stories that women are traveling through their car for 2 hours during the labor to find a bed or to find a hospital to deliver the baby, which is horrifying. So I am little worried for that. But yeah, having said that, whatever care I have received till now throughout my pregnancy, I am quite satisfied. I am quite happy. The midwife which was been assigned to me is quite experienced. She makes me feel very comfortable. Only the medical care that I get, also my emotional well-being, also my physical well-being, all things are being checked. So I am quite happy with that care. In general, Sweden's healthcare system is overburdened because population is increasing and probably they do not have enough healthcare facilities. Many political leaders and many political parties are discussing this. If you ask me personally, I have very mixed feelings about Sweden's healthcare system. There are days when I absolutely love the Sweden's healthcare system. The way I am getting the treatment for my pregnancy throughout last 6-7 months, whatever care I have received, I am loving it. But there are days when I absolutely hate the system and I feel like crying, because it gets sometimes difficult when you don't get enough attention, when you think that okay, I am ill, I am sick and I need attention, and probably the Sweden's healthcare system or doctors do not think okay, I am not seriously ill and probably I do not need enough attention. So I have mixed feeling. Based on which day you are asking me, I might give you the feedback. So, but yes, I would say in general, it is working for Sweden. Sweden's population is quite healthy. This is my personal opinion. It is not coming from any of the expert. So please take this with pinch of salt. And finally, thank you so much for watching till here, and I hope the information that I have shared is quite helpful. Please do not forget to like, share and subscribe. I will come back again on this channel on a new day with a new topic on a new video. Till then, please stay tuned. Do not forget to like, share and subscribe. Bye till then.